Welcome to this presentation on the Pneumovax 23 vaccine. What do you need to know? This presentation will be discussing the importance of the Pneumovax 23 vaccine and what health risks you may acquire if not protected by this vaccine. What is the Pneumovax 23 vaccine? The Pneumovax 23 vaccine is given to protect individuals with chronic conditions from pneumococcal disease and to protect the population from devastating illness outbreaks. Pneumovax 23 is commonly known as the pneumonia vaccine or the pneumococcal vaccine. Pneumovax 23 protects individuals from acute illnesses such as ear infections, sinus infections, meningitis, blood infections, as well as pneumonia. The illness can be life-threatening, and the germs can invade the bloodstream and body tissues, causing a septic illness, which may lead to hospitalization and even cause death. What is the significance to you? Continued populations remain unvaccinated and undervaccinated, which puts populations throughout our communities at risk of illness and even death when contracting pneumococcal disease. Pneumococcal disease continues to be a large burden to our communities, putting populations at risk of disease that are fighting chronic conditions that are debilitating to their health. Healthy People 2020 have made a goal to reduce hospitalizations and illness in preventable diseases by recommending and educating populations on the importance of vaccines to prevent disease. Why is this important to you? You may be at risk related to your current health status. You may have received the vaccine in the past and are recommended to be revaccinated. You may have turned age 65 and are recommended to be administered the vaccine for protection. Pneumococcal disease, when contracted, can be severely debilitating and even cause death. What important learning objectives I will be discussing will be what infections can be acquired if the Pneumovax 23 is not received, what populations are at risk and are recommended to receive the Pneumovax 23, and how often should you receive the Pneumovax 23? What is pneumococcal disease? Pneumococcal disease causes illnesses that can be life-threatening, and hospitalization is often seen. Pneumococcal disease in the United States has seen an estimated 302,000 hospitalizations for pneumonia, 7,000 cases of blood infections such as sepsis, and 1,700 cases of meningitis each year in adults aged 50 and over. Adults are put at risk each year if not vaccinated, and most populations within communities are not aware of the vaccine being available. How do we protect ourselves? We prevent infections by hand washing and preventable treatments such as receiving the Pneumovax 23 to protect ourselves and others from outbreak of illness in our communities. Let's talk about the Pneumovax 23 vaccine. The vaccine protects individuals from 23 bacteria that pneumococcal disease can cause. This is where the name Pneumovax 23 was developed. The vaccine is given to the individual just as they received the flu shot, typically in the upper arm. It may cause some discomfort and tenderness, but is generally given and no side effects are reported. Most healthy adults are protected within 2 to 3 weeks after the vaccine is given. Who is recommended to receive the Pneumovax 23? Populations at risk are those with chronic illnesses such as heart disease, kidney disease, diabetes type 1 and type 2, COPD, asthma, HIV and AIDS, cancers, alcoholism, cigarette smokers, those with cochlear implants, and also those with cerebral spinal fluid leaks. Elderly living in long-term care, as well as individuals living in group homes, are also put at risk. The vaccine is recommended for all adults age 65 and older. It is also recommended for anyone ages 2 through age 64 with a weakened immunity system. It is also recommended that anyone at the age 2 years through 64 years old with long-term health problems. Adults age 19 through 64 that smoke cigarettes or have asthma should also receive the Pneumovax 23 vaccine. How often should the vaccine be administered? It should be given once every 5 years, and for some individuals, their physician may recommend it being administered more often or less often. Five reasons to receive the Pneumovax 23. Pneumococcal disease is serious and deadly. In the U.S., pneumococcal pneumonia, meningitis, and bloodstream infections such as sepsis can kill tens of thousands each year, including 18,000 adults aged 65 years and older. Getting vaccinated can help you avoid serious health dangers. About 1 million U.S. adults get pneumococcal pneumonia each year. This type of pneumonia is particularly severe, killing 5 to 7% of those who contract it. The death rate is even higher in older adults. Pneumococcal meningitis kills about 1 in 3 people who get it. People who survive pneumococcal meningitis can suffer from devastating health problems, such as hearing loss, seizures, blindness, and paralysis. Up to 1 in 5 adults with pneumococcal bloodstream infection, such as sepsis, will die. For those who survive, recovery is not easy. Treatment requires hospitalization, and patients often need weeks or months before returning to normal activities. Getting pneumococcal vaccines, as recommended, reduces your chance of contracting and dying from pneumococcal disease. 2 types of pneumococcal vaccine are recommended in the U.S. currently. Your healthcare professional can tell you if you should be vaccinated and whether you need one or both vaccines, as well as how often you should be re-vaccinated. Some key points I hope you have taken from this presentation would be: prevent pneumococcal disease by getting vaccinated. Know if you are at risk and prevent further disease. Continue to follow vaccine recommendations for continued protection. Let's review what we have learned. The Pneumovax 23 vaccine is given each year with the flu shot. True or false? The answer is false. It should be given every 5 years or as recommended by your physician. Pneumovax 23 is administered to patients that are considered at high risk of contracting pneumococcal disease. Risks that pertain are, please choose all that apply. The risks that individuals may have that put them at risk of pneumococcal disease are asthma, diabetes, cancers, and cochlear implants. Pneumovax 23 protects populations from illnesses such as, please choose all that apply. The illnesses that are prevented with Pneumovax 23 are sepsis, an infection of the bloodstream, pneumonia, and meningitis. For more information on the Pneumovax 23 vaccine or pneumococcal disease, you may visit any of these websites listed in the references below. Thank you for listening to this presentation on the Pneumovax 23 vaccine. Any questions?